Looking ahead, challenges and opportunities in the changing world. Welcome to Talking Economics, podcast launched on the occasion of the 30th anniversary of the Center for Economic Research and Graduate Education, Economics Institute. My name is Katarina Stehlíková, and with my today's guest, we will talk about health economics and its contribution to the current debate on health, healthcare, and healthcare policy. Let me welcome Eva Hromádková, CERGE-EI Ph.D. in Economics Alumna and the Program Director for our Masters in Applied Economics program. Eva also works in the Monetary Department at the Czech National Bank as an Expert Analyst of the economy. In 2020, she joined the Research Center for Modeling of Biological and Social Processes.
Thank you for inviting me.
Eva, since your PhD studies, your work focus has partly shifted. Are you still involved and interested in the field of health economics, and in which way?
Indeed, after I graduated, I have started to work as analyst of the economy in the Czech National Bank. And then I returned to academic world as the program director of CERGE-EI's ME program. Nevertheless, I have still stayed involved in the health economics field, mainly due to my courses of health economics that I regularly teach, which requires me to follow the latest developments in the area to be able to share them with my students. Also, I have become more involved in the policy part when I joined BISOP during the second wave of COVID pandemics last year.
As we are all aware of, the pandemic is primarily a health and healthcare crisis, and as such, it naturally had to affect your field. In your opinion, what are the main areas it had altered, and how?
Well, when I think about the effect of pandemics, I'm dividing it into two natural channels. First is the policy side, where healthcare policies and regulations enforced by government affected the whole population. Actually, it seems that almost everyone claims to be an expert on the ways how healthcare policies should be designed and implemented. On the other hand, from purely academic viewpoint, pandemics is perceived as a one-of-a-kind natural experiment that helps researchers to identify different research questions in the area, starting from the effect of lifestyle on the healthcare demand to the long-term effect of changes in the healthcare supply.
So let's start with the public policy part, as it really became the part of our lives recently. What do you perceive as the main topics in connection to healthcare economics, to health economics there?
Well, first and foremost, it is the role of governance and institutions. During pandemic, almost all countries in the world, maybe with the exception of some Asian states that have had recent experience with SARS and MERS pandemic, faced an unprecedented shock which revealed a lot of unpreparedness in the emergency planning, procurement, communication, and mechanism design. We didn't have to reinvent the wheel, however. There were best practices on almost all the aspects of necessary policies available, whether we talk about testing, tracking, or introduction of restrictions. Nevertheless, government decisions made were definitely not evidence-based, but driven mostly by popular demand. Here in the Czech Republic, it led to 4 waves of pandemics and more than 30,000 lives lost. It was also interesting to see how certain institutions, until then known to few in the field, have become household names. For example, SÚKL and EMA in relation to the vaccine approval or evaluation of possible drugs against COVID, or if you remember ÚZIS concerning the provision, or I would say rather lack of, information about the course of pandemics. Numbers of tests, numbers of hospitalized patients, number of deaths. By the way, communication and publication of data about the pandemics have been a great issue during this time in all the countries. And although there has been a great improvement over time, some important measures are still missing. Of course, health data are sensitive information, but there are externalities that we need to consider, and access to data is necessary condition for any analysis that the researcher might want to do.
It seemed that communication regarding the restrictions have been rather ineffective. At first, public was afraid of the unknown and thus followed the restrictions to the full. Afterwards, however, they became less vigilant and mostly doubted them. Could you, health economists, help with that?
I think this is what we are trained for. One of the areas of health economics focuses exactly on the comparison of different treatment scenarios and calculations of cost efficiency. We know how to estimate the effect of restrictions on the probability of infection and translate it into number of lives saved. We can assign values to those lives, although this has a very accounting-like sound and is not perceived that well by general public. And we can also estimate the cost of restrictions on the economy and compare them. Most of the times it is rather intuitive. It is much more efficient to invest in proper testing and tracking than to reach for the ultimate lockdown of the economy.
These are all very discussed themes, and most of our listeners probably had at least an idea about their existence. Would you like to point out an area of public policy that might be much more overlooked?
I would say international dimension. During pandemics, most of the countries have closed down and tried to combat the illness with their own resources. Nevertheless, due to fast spreading, coordination of policies will be necessary, and not only at the level of neighboring countries or integrated entities like EU, but in general. We need to agree on what is the safe travel, on the regulation of medical goods, on regulation of vaccines, etc. Other international aspect that I perceive is equity and access. Current pandemics has a potential to broaden the income-related differences across countries. To be more specific, I have recently taught a class of Georgian students, and we discussed vaccination strategy and results here and there. While in the Czech Republic, almost 10% of the population is currently fully vaccinated, and we consider it a rather slow progress, in Georgia it is 0.4%. Can you imagine what are the consequences for the economy, trade, recovery as such? In some of the African countries, the only vaccine that is available comes from the donations of wealthy countries. This is a tragic situation and has a potential to escalate in the future. However, this is mostly a political issue. Health economists can only point out obvious consequences.
And it is very important that you do so. We've talked extensively about the policy applications and aspects of health economics. So let us go back and talk more about the impact on health economics as a science. Do you see a shift in the research topics in this area?
As I have mentioned before, pandemics can be perceived as a one-of-a-kind natural experiment that introduced exogenous shock into all aspects of our lives. In the current health economics conferences, I have seen a lineup of papers that describe the changes in the lifestyles and health behaviors, such as more time spent at home, less exercise, different diet consistent of home-cooked meal, and their impact on health status and demand for healthcare. Some of it might go in the direction of better health. For example, when people started to exercise more, some of it might go in the opposite direction.
All these changes are a consequence, well, to a large extent, of the lockdowns. Are there other topics which are directly linked to healthcare and health that are being explored?
Sure. The topic that has probably gained the most importance has been mental health. But I do not by any means suggest it is a new topic. Already before pandemic, mental health has become one of the leading research areas, mainly in the European countries, while US has been interested mostly in the effects of insurance, thus each of them hinting at the weakest points of their respective healthcare systems. Indeed, even here in the Czech Republic, the mental health has still the label of stigma, and psychotherapy is not covered by general insurance. Add to this anxiety and stress caused by unknown illness, and combine it with the restriction of social interaction, demands on additional labor, mainly for women, and you get a perfect storm, leading to heightened levels of severe depression symptoms. Other separate issue are the consequences of limited access to care. Due to increased pressure on healthcare providers, some medical services have been cut, surgeries were deferred, medicines were not updated, and this all could lead to worsened health outcomes in the future, and we see the evidence already now. Finally, to end on a more positive note, even in the field of healthcare, we have come up with new ways how to deliver. Telemedicine, much broader use of technologies in general. We were able to speed up standard research and development procedures to roll out vaccines. The society has created completely new systems and institutions to manage the pandemics. I think this has a potential to positively impact future costs of healthcare, as well as the ultimate health outcomes. And that is what matters the most, that we are able to learn from the crisis and continue stronger.
Evi, while this is an extremely broad topic with a lot of different aspects, I think we have used up our time. Would you like to add a summary of how the pandemic changed your field?
Well, when I chose health economics long time ago as a field for my dissertation, I was the only one at CERGE-EI, and I did it just because it was interesting. In the last year, the interest seemed to seize most of the population. Well, this is indeed great for the field, and I'm actually looking forward to all the new studies and findings. For us all as human beings, I just wish the antidote to the Chinese curse. May we all live again in the boring times.
Thank you.
Thank you. Have a great day.